My name is Heather Bachman. I'm a coordinator in the Student Support Services Department at the Genesee Valley Board of Cooperative Educational Services, commonly known as BOCES. Our department provides technical assistance and professional learning to school communities on comprehensive health and wellness related programs, policies, and practices. We know that schools are doing a lot to support the health and well-being of their students. However, many times it isn't as coordinated and aligned as it could be. School districts are required to have a local wellness policy if they participate in federal meal programs. The policy serves as a roadmap. It guides a school district's efforts to establish a school environment that promotes students' health, well-being, and their ability to learn. For example, in the local wellness policy, school districts are required to include specific goals for nutrition promotion, nutrition education, opportunities for physical activity, and other school-based activities that promote student wellness. And they're required to consider evidence-based strategies when creating these goals. Another required component of a local wellness policy is to include standards for foods provided to students throughout the school day. This includes things like classroom celebrations, snacks at events, and using food as a reward. The local wellness policy promotes health habits for students, which in turn supports their academic success. We know that healthy kids are better learners. The research tells us that proper nutrition and exercise leads to improved concentration, memory, and classroom behavior. However, we noticed some gaps in school districts' practices and what is required by the local wellness policy. So we were eager to work on creating healthy schools and communities, also referred to as CHSC, so that we could partner with schools to help bridge these gaps. We wanted to help school districts implement and sustain equitable and inclusive strategies that foster the health and well-being of students, their families, and the community. Through CHSC, we developed a full-day hands-on learning session about how to effectively create and implement a local wellness policy. During the session, we presented research that links healthy eating and physical activity to academic performance. School teams compared their own district wellness policy to a model policy to identify strengths and areas in need of improvement. We then shared tools and strategies for improving and communicating wellness policy efforts and facilitated activities to help school teams develop action plans to bridge their gaps. We guided them to create SMARTY goals to support their policy implementation practices. A SMARTY goal is a goal that is specific, measurable, attainable, realistic, time-sensitive, inclusive, and equitable. As a result of the training, school districts updated their policy to reflect policy requirements and the unique strengths of their school community. For example, before the session, one school district didn't have a measurable goal for nutrition promotion in their local wellness policy. As a result of the session, they developed an action plan to offer taste testing opportunities to expose students to locally grown foods. Now, students are more likely to eat those foods when they're served in the cafeteria. Another school district lacked opportunities for physical activity throughout the school day for their students. So they created a plan to provide resources and annual training to their teachers on how to naturally integrate physical activity into the classroom and lessons. And as a result, students are moving more throughout the school day. Additionally, our feedback surveys showed a positive response to the training. Every participant said that they felt ready to make recommendations to their school district about ways to communicate local wellness policy requirements to their school community. They also felt able to identify next steps that would improve the district's local wellness policy. A school district superintendent even said, "This training gave us practical tools and expert guidance to evaluate and strengthen our district's wellness policy. Thanks to the support from the Genesee Valley BOCES CHSC coordinators, we're moving forward with clearer goals and a renewed focus on student health and well-being." Now that the foundation has been laid, the school district teams that attended the training are in a better position to support the health and wellness of their students, their staff, and their community. They learned sustainable strategies to ensure that their local wellness policy doesn't just sit on a shelf somewhere. They now know how to make sure that their local wellness policy is an ever-changing document that reflects the unique characteristics of their school community and supports the health of all students. Because of CHSC, we have healthier schools, communities that are more engaged, and established partnerships that will play a large part in sustaining CHSC. The impact of this work will continue far beyond the life of the initiative. CHSC has helped build a culture of collaboration, inclusivity, and shared responsibility for schools and communities to continue advancing health and supportive environments.